Good afternoon. Welcome to the daily briefing at the EMA office, where we're joined with Chairman Mark Kern and today the Director of the Health Department, Barb Hope. Barb, thanks for being here today with the numbers.
Hello, how is everyone today on a gorgeous day on a Tuesday? Again, this totals for St. Clair County for today. We have 513 folks that have tested, and of those, 33 were positive, both males and females from under the age of 10 to 90 years of age, which brings our daily positivity rate to 6.4% with today's numbers, and overall a 7-day rolling average of 4.8%, which is awesome. Way to go, Team St. Clair. Therefore, that makes St. Clair County total numbers tested 93,643 tested. Of those, 7,754 were positive, and 85,889 were negative. Unfortunately, today we have one death to report in St. Clair County. It was a female in her 90s with unknown health conditions, bringing our St. Clair County total deaths to 197. Again, our thoughts and prayers go out to all those folks and families of those that have died due to COVID-related illness in St. Clair County. Statewide, we have 1,617 folks that have tested positive, and unfortunately we have 32 deaths in the state to report, therefore making the state totals 5,974,469 that have been tested. Of those, 305,011 were positive, and a total of 8,836 folks in the state of Illinois have died COVID-related illness. Hospitalization numbers in St. Clair County hospitals. Today we're reporting 46 patients with COVID-related illness are hospitalized, and 4 of those 46 patients are on ventilators. Regionally, we have 74 patients that are in the region hospitalized due to COVID-related illness, and of those 74, 7 are on ventilators. As far as reporting on congregate settings and long-term care facilities, today we have 1 additional case and 1 death to report at the Escalon Dammert Center at the Shrine, for a total of 38 cases and 4 deaths. Again, we have several testing sites available throughout St. Clair County this week and around the area. You can look on EMA's website as well as the Health Department's website for a continuous banner of all the different all the different clinic sites that are available. Today and tomorrow from 8 to 4, we're at McKendree University, and that's both a drive-up and a walkthrough. Thursday, we'll be at the Moose in Swansea, and those times are from 10 to 12 and 1 to 3 at the Swansea Moose. On Saturday through Tuesday, Saturday, Sunday, Monday, and Tuesday, we'll be at St. Clair Mall in the back behind it, like in the Dillard's parking lot back there. On Monday and Tuesday, October 19th and 20th, we'll be at SWIC. Again, that's a drive-through and a walk-up will be available at SWIC. On Wednesday and Thursday, October 21st and 22nd, we'll have a drive-through available at the St. Clair County Fairgrounds. And then Saturday and Sunday, October 24th and 25th, we'll have a drive-through available on the back side of Belleville West High School, 8 to 4 on that weekend. So we have several test sites available for folks to be tested throughout St. Clair County. And with that, I will turn it over to Chairman Kern.
Thanks, Barb. We'll move into the zip code report. Today we have a few that actually went down and then the rest went up. So we'll move into that. 62203 goes down 1 today to 223. 62204 goes up 6 to 154. 62205 goes down 1 to 219. 62208 goes up 6 to 467. 62220 goes up 3 to 597. 62221 goes up 3 to 718. 62223 goes up 1 to 469. 62226 goes up 6 to 809. 62232 goes down 1 today to 201. 62240 goes up 2 to 39. 62257 goes up 1 to 38. And 62258 goes up 1 to 200. 62269 goes up 2 to 607. And 62285 goes up 1 to 135. The state pegs our regional positivity today down a couple points to 6.7%. We give, using the numbers, the real numbers that we generate here in St. Clair County, we are at 6.4% daily county positivity today, and that brings our 7-day rolling average, once again, way below 6.5 to 4.8%. The state derives that 6.7% regional positivity with Bond County checking in at 13.3%, Clinton County 9.7%, Madison County helping out today at 2.9%, Monroe County comes in at 19.2%, Randolph County for 4.1%, St. Clair County is at 6%, and Washington County in with 66.7% positivity. So it's pretty clear that we're a bright spot in the region. We got some help today from a couple other counties, but if we're going to get below that 6.5% level, there's going to have to be some changes made.
Well, and as we say, and this is 207 days that we've been preaching this and asking for these numbers to get better, and Washington County 66.7%. There's no reward for being the highest. We want the numbers to all be down as low as possible.
And our businesses are trying. They're requiring people to wear masks. They're following the rules, and yet they're faced with being held to the standard of a county that are counties that aren't following the rules, that their health departments aren't as conscientious as Barb in doing things. So that's why we see these high numbers that come in, and they turn what we know was our daily 6.4%, 7-day rolling average of 4.8%. They push that above the 6.5% level, and here it is Tuesday, and we're not below 6.5 where we really thought we would be. Given the falling of the numbers, we felt pretty confident that we would be at 6.5 or below today with the regional numbers, and it just didn't come to fruition.
Well, and we keep plugging at it. I had a couple of mayors call this morning and asking about our prediction, and everybody's sitting on pins and needles waiting and hoping that we were going to get that, and then when they come in this afternoon, we're faced with that, but we'll continue to do that. Watch those numbers and keep praying that we can get those numbers down and get some help from the other counties who haven't. We got calls today about, well, why is the pizza place over in Granite City opening up today? Well, you need to ask that to Madison County. As we said on Sunday during the question and answer session, that if you're a business person, you need to be checking with your insurance carrier, because some of the local mayors here in the county have shared with us that they have done that, and they may not have liability coverage. So I would definitely encourage you to do that. Another question that came in yesterday evening, that we were advocating people going out there and open up. I don't think we've ever advocated that. We've all said that, we're going to do what is the best for public safety, public health, and that's why our health department is working around the clock basically some days to try to get these words out. We want to give a shout out to the Northwest Fire Department. They've got their marquee out there talking about social distancing and the masks, that they do work. So we appreciate all of our first responders that continue to spread that word.
And this is Illinois Department of Public Health that's making this call.
Yes.
They're the ones that are saying, we're setting the rules, we're setting the numbers, and it isn't the governor set the guidelines, but the Illinois Department of Public Health is responsible for the numbers, and that's why we talk about numbers every day and why we're so careful about the numbers that we present, and we take it personally. We do 207 days of sitting here and working on these things. It's very personal to us, because I'm telling you, to the businesses that are out there that are closed, I guarantee you it's very personal to them because it's their livelihood, it's their future. You know, they've got mortgages, they've got families to feed, and if it's an unfair playing field, if it's an unlevel playing field, that's not right. And while we're all here to fight COVID-19, and we've been doing so, it doesn't make sense that here we are, you know, the entire month of September, all into October so far, and you know, we've been well below 8 since, you know, for whatever this is now, almost 40
6.
days, and we've got places in the state that are higher than we are, and yet they're open, and that is an issue, and Illinois Department of Public Health needs to take a look at their numbers and take a look at this situation.
Well, and it's, we say all the time, you know, and you just said it, you know, the governor set the guidelines based on the scientific information that was provided to him and his staff by the scientists, the medical experts, and, you know, he has said from day one, kind of like what we had, it's a balancing act. You know, you got to have public safety, you got to have public health. We don't want our people sick. You know, 197 people have died in St. Clair County, another 32 deaths statewide, over 8,836 deaths in the state. You know, if we can all get on the same level playing field, as Chairman Kern said, then, you know, it's equal. But, you know, county to the north of us that are opened up, county below us is opened up. People are going there. If they're getting infected because they aren't following the mitigation, guess where they come back home to? They come back to St. Clair County. And our business people are showing, the mitigations that they're doing is showing it's working, because look at our numbers. But it's not fair that they're not being treated as other counties are. So we'll continue to work on that, and please, Team St. Clair, continue to spread the word and hang in there. I know you get tired of hearing us say that. I read the messages every night, answer as many of them that we can. I understand what you're saying, but it is a fight. We said that from day one. Nobody said it was going to be a flip of the switch. And we're here with you. We're going to be here. And we'll be back shortly with Cindy and Daisy to translate this into the Spanish communities. And then we'll be back tomorrow with some more numbers for you. Have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grub, Hub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and lock
Buenas tardes y gracias por acompañarnos una tarde más. Barb Holt con el Departamento de Salud estuvo con nosotros hoy anunciando los números del condado y del estado. Estamos a 93.643 exámenes conducidos. Esto incluye 513 exámenes conducidos del día de ayer y 7.754 casos positivos, que incluye 33 nuevos casos de hombres y mujeres en las edades de menos de 10 años a 90 años. 85.889 exámenes negativos y 197 muertes, que tristemente incluye una nueva muerte de una mujer de 90 años que no se le conoce ningún problema de salud previo. 7.111 es el número de personas que obtuvieron un resultado positivo y que han completado los 10 días de aislamiento requeridos por el Departamento de Salud. Estamos a 6.4% de casos positivos en el condado y hay 46 pacientes hospitalizados por problemas relacionados con COVID y 4 de ellos en ventiladores. En la región hay 74 hospitalizados y 7 de ellos en ventiladores. Hoy solo reportamos un cambio en el número de casos en las instalaciones de cuidado a largo plazo, que es en Escalon, con 38 casos y 4 muertes. Y los números estatales son de 5.974.469 exámenes conducidos y 305.011 casos positivos, que incluye 1.617 nuevos casos del día de ayer en el estado y 8.836 muertes, que tristemente incluye 32 nuevas muertes en el estado. Esto hoy los dejo con Cindy.
Buenas tardes. Mark Horn nos dio los códigos postales con casos positivos, que son 62205, 219 casos con un caso menos de ayer. 62208, 467 casos con aumento de 6 casos. 62220, 597 casos con aumento de 3 casos de ayer. 62221, 718 casos con aumento de 3 casos. 62223, 469 casos con aumento de 1 caso de ayer. 62226, 809 casos con aumento de 6 casos de ayer. 62240, 39 casos con aumento de 2 casos. 62257, 38 casos con aumento de 1 caso. 62258, 200 casos con aumento de 1 caso de ayer. 62269, 607 casos con aumento de 2 casos. Y 62285, 135 casos con aumento de 1 caso. Y en la región 4 estamos al 6.7%. Y finalmente, Harvard nos recomienda que sigamos usando el cubrebocas. Muchas gracias.